When someone comes into the emergency room with stroke-like symptoms, the first thing to determine is, number one, do we think it's a stroke? We diagnose a stroke first by history and physical examination. And then we take a picture of the brain. And the reason is because there are many different types of strokes, sort of two main categories, a bleeding stroke, which is called hemorrhagic, versus an ischemic stroke, which means reduction in blood flow. We may take a CAT scan or CT scan, which is an X-ray of the brain, in order to look to see what type of stroke. When EMS is bringing in a stroke patient, many times they pre-notify the emergency room, which means they call ahead to say that they're having a patient with a stroke. And so we call a stroke code. And what that means is the whole stroke team, all the doctors that care for stroke, come to the emergency room, and we rapidly look at the patient, but then take them right away to have imaging, because we're trying to shorten the time period that we need to do certain things to decide they're having a stroke so that they get treatment rapidly. The next thing is that we have to do lab tests. We have to make sure that their sugar and certain other levels are appropriate. We also have to do an EKG because we know that the brain and the heart are obviously connected. And sometimes if people are having a stroke, they might also have some heart problems. So we need to know that their heart's okay. Then we need to go through history in terms of the medication they're on. They haven't had surgery recently. So there's a whole checklist in order to give them a very strong blood thinner. So we need to know that we're not risking further injury, but we're trying to help them. As a stroke neurologist, vascular neurologist, I think of myself as a detective. Not everybody comes in with their medicine list and what happened, etc. So sometimes you need bystanders or co-workers or family that can really fill in the details. What time did this start? What did you notice about the patient? In order to try to fill in the missing pieces if the patient can't tell us all the information. When someone has a stroke, the first 24 hours is the greatest risk of having another stroke, because whatever happened or whatever caused the stroke can happen again. So it's very important to come in, even if you're not in that early time window, to try to figure out why you had the stroke, to reduce the chance of it happening again.